When Dr. Dominic Tolitano isn't doing a vein procedure, he's doing this, open heart surgery.
I take with as much interest in the vein procedure, as much care and compassion as I do when I'm fixing a heart.
The cardiovascular and thoracic surgeon has done over 5,000 open heart operations and 4,000 minimally invasive procedures for vein problems.
People who have the training and the skill level to do invasive procedures, those people are head and shoulders more qualified to do this procedure than anybody else.
Dr. Tolitano often transplants these same leg veins during open heart procedures. That experience helped him become a pioneer in treating varicose veins and other vein conditions with new minimally invasive techniques. The surgeon has come a long way from the west side of Chicago where he grew up.
My dad was a shoemaker, came over on the boat from Italy, and thought it was a good idea if I became a doctor, so he got me a job at a hospital. I would sneak into the operating room and watch procedures and became interested in the field of medicine. I think it was seeing that people so vulnerable when they're sick and how much joy the physicians and nurses got making them better. That was very instrumental to me.
After graduating from Loyola, Dr. Tolitano went to Chicago Medical School, did a surgical residency, then went back for his cardiovascular and thoracic fellowship at Loyola. Then he received a portion of his training under world-famous heart surgeon Dr. Michael DeBakey. Dr. Tolitano next headed the largest cardiovascular surgery group in Nevada. But in 1995, he returned to Chicago, partly to bring up his young triplets and partly to treat veins.
I'm one of the few cardiac surgeons left who still does cardiac, vascular, and thoracic surgery.
In 2001, Dr. Tolitano started advanced vein clinics. Today, Sheila Marcinowitz has come to have Dr. Tolitano operate on her itching, throbbing varicose veins.
Knowing that he has, a lot of credentials behind him, it really helps.
Dr. Tolitano's first rule, all varicose vein procedures are done with minimally invasive techniques. His second rule, patients have absolutely no pain. Sheila, like 90% of the surgeon's patients, chose to receive a short-acting anesthesia.
We are the only vein clinic that uses IV sedation. We have an anesthesia group that is very well known, nationally known. They feel no pain whatsoever.
The surgeon is assisted by the same nurses who once handled his open heart cases.
He's been working with this system for over 20 years. He's very comfortable and he's very confident, which makes everybody else in the OR confident. It's a very nice environment to work in.
Guided by ultrasound, it takes the cardiovascular surgeon just a few seconds to thread a catheter into a poorly functioning vein. Next, he seals the vein shut with a tiny laser beam. The whole procedure takes just 20 minutes. Results are 98% successful. Patients go right back to their normal activities. Sheila left the office just 15 minutes after her procedure.
It's the perfect surgery because you go in and you go under, and when you wake up, there's no pain involved, and you just kind of walk out. And it's good. It's a good surgery.
I like having a problem, solving it, and seeing the patient get up and leave and be in good health.
Recently, Dr. Tolitano became one of only 3 Illinois surgeons to offer this even less invasive technique called Clarivein. While used mostly on the lower legs, it has even less discomfort and bruising and produces an even faster recovery.
I think it's important to have different modalities of treatment. Some patients are better with the laser, some patients would be better for Clarivein, but it's good to offer both.
Treatments are increasing because every year, 35 million people are affected by the pain and discomfort of varicose veins.
It's not a cosmetic problem, it is a medical problem. That's why all insurance carriers, including Medicare, pay for it.
Advanced Vein Clinics also treats patients with spider veins and venous ulcers. Dr. Tolitano's goal is simple: to provide the best treatment anywhere to confront the growing epidemic of vein problems.
My motto is, we're going to do everything that you need, no more, no less. And that's what I pride myself on in my practice. We do nothing unnecessary. We're very honest with our patients, and they will get exactly what they need, no more, no less.